Okay, part three. And this time it's a real part three. so, okay, so basically now in the part three, what I got here, I'm going to start with this. Those are the instrument. And so basically we went through that one. So I got a little pocket right in the center over here where I keep like basically a mirror, dental mirror, to go with this kit right here that we'll talk about. Another clamp, and over here like a few safety pins, and as well as a pair of tweezers, as well as I carry a nail clipper and one of those little Dermasafe kind of thing. As well, in this pocket I carry alcohol prep pad. And now there's my little rant about alcohol prep pad. In pretty much every first aid kit you're gonna find those things because they're cheap, but the only use that they have is to clean intact skin. So like when I use those at the hospital all the time if I want to start an IV. But if you have a wound, so that means that the integrity of the skin has been broken, you don't use those. Those are terrible for that. But to clean your instrument or sterilize, well, not really sterilize, but more disinfect, because sterilization is a different process, but to clean your instrument, alcohol pad will be awesome. So basically I carry two of those in that little pouch for all those instruments. Or if for example, if I'm using this on two different victims, sorry, I'll clean my my tools in between, or if after I use it, I'll clean it with the alcohol. And so that's why I carry two different alcohol right over here. Over here, I got my little kit for dental emergencies. And so basically I got a bunch of rolling pads and stuff, and some I think it's olive clove, but yeah, oil of clove, but it has a little bit of bunch of other stuff as well. It's called Warn Pack, but basically it's olive clove. So basically it's for analgesia if you have a pain in a tooth and stuff. And that this thing is Cavit, which is basically temporary dental temporary dental fillings, and a bunch of pads there if I have like a bleed or things like that. And so, and this is just an instrument to kind of mold the stuff over here into your tooth. Also have a razor in case that I have to shave. For example, if you have a very hairy person and you need to apply a dressing or something like this, then you need to be able to shave, because that way the dressing will adhere much easier. Especially most of the stuff I have here is kind of sticky, so you have to shave the person and stuff like that. So carry a razor for that purpose. Over here, it's my trauma gauze, and the reason I carry this one versus like what most people carry, so the I always forget the name of that other one. Anyway, the other one is like a little beanie bag, or like a powder. That thing comes also in the powder, but this one is the gauze one. So basically all it is, it's kind of roll of gauze, but it can control moderate to severe bleeding. So basically the advantage of this one versus the little beanie bag is that if, for example, I have a puncture wound, so if, for example, I enter my crampons in my leg or something like this, it's going to be a puncture wound. So basically it's going to be a hole like this. What if I apply a beanie bag on a hole that is like this, and the bleeding is inside? So if I put the bag on this versus but the bleeding is kind of over here, it won't do much to help. Direct pressure will help, but so at least I can enter this. And as well as you can see over here, for control and management of first and second degree burn. So basically what this thing does is that if you wet it, there's a little gel that's been formed with it, and so it can be used as well as for first and secondary burn. I do have other dressing in that kit for minor burn, but for example, let's say you were starting your stove and your stove your clothes catch on fire, and basically now you have your whole arm in burn. Well, then actually now I can apply this thing and I can wet it. I still have to do a few more testing and stuff, but it made it into my first aid kit, so I'm starting to carry it. And you'll see there's different product out there. So there's some of those dressings, like for trauma gauze, they're made of starch, so the same thing as you would have like with potatoes and things like that. So they're made of certain starch. Some others are made of other product, which the first generation they were having problems because it would create some heat and stuff, which the third generation doesn't create. This one is made of basically shellfish. It's a chitosan. So basically and shrimps, the thing that makes it pink, that's what they use. They kind of remove it from that and they make a thing. Nowhere in the literature there's been case reported of using this in people that are shellfish, so allergic to shellfish, that have created any reaction to it. So no case in the literature that has done. But obviously there is a possibility of having reaction, but nowhere in the literature has been a case for that. So this is what I carry over here. In the back pocket over here, I carry my the 3M there for wrapping, so that's odor adherent, as well as I carry 3 mini pads. Well, obviously you can see they're very small. They're good as well for fire starter and stuff, but they can have a different purpose. So I can use that for as an external dressing, and I'll talk a little bit more when I'll do my dressing video, but I can use that because obviously it has a good absorption. It can be used for what it's intended to be used. Ladies. And as well as again, when I was talking, if we have like a, well, you saw the big depends that I carry, but as well it can be used for that purpose as well. So if I have someone that, you know, is unconscious, or somebody that has like a big pelvic fracture or something like this, those are considerations that we have to think, and that's where, for example, regular first aid do not talk about it. Because what happened in first aid is basically the ambulance will be there in 5 to 10 minutes. But wilderness, it's quite different, because you're going to have to maybe be there for 6 hours. Maybe you'll have to be there even for 2 or 3 days. So those becomes consideration that you have to think about. And so basically I carry 3 of them, because as you can see, they weigh nothing. And it can be used, they have multiple use, so they made it in my bag. Over here, a Foley. So basically a Foley is what they put in your urethra when you go to the hospital and things like that. And basically at the end of this, like right over here, there's a balloon. And so it goes into your bladder like this, and then the balloon inflates, and then it prevents it from coming out. And basically now you can drain urine. But as well, it has multiple use. The balloon over here is, there's different ones. There's with 10 cc's, which is the ones we usually use in the hospital. But this one is 30 to 50 cc's, so pretty decent size. And now it can be used as well for epistaxis, so bleed in the nose, especially interior ones. So basically, you can put the balloon in and kind of do like a direct pressure on the nose with those things, as well as the NPA that you saw previously. I can use that as well. I can improvise an NPA with that. So if I would really had to, I could use that as a slingshot. And so it has different use. So basically, I made it again very easy to compress and very easy, no weight, so multiple use, made it into my kit. Oh, and also when I was thinking, so again, if for example, one thing I wanted to mention, the best way to tell people if if they're in shock or something like this is to measure the urine output. So now with this, and for example a water bladder, I can pretty much measure my urine output very closely and really know if somebody is getting worse or not. And it's much accurate, the urine output, than any of the vital signs and stuff like this. So I can do some pretty cool assessment with that stuff. So. Then after that, I carry an extra band of surgical surgical tubing, and basically now this thing has pretty much about the same use of this, but as well, you know, like I was saying, I could make like a slingshot with that. I can use it as a tourniquet. I can do tons of stuff. So weigh nothings and takes no space. So up in this first aid kit. Dehydration, so 2 oral rehydration salt package. Those are the Adventure Medical Kit ones, and so basically you just mix that with in 1 liter of fluids, and you got yourself some stuff to rehydrate people. So if you have big diarrhea and stuff like this, you got that. Now, what is that? Oh my God! This is a cold pack. Yep. So if you ever open a cold pack, there's 2 different things in there. There's a pouch of water. So if you cut the cold pack, there's a pouch of water, and then there's a whole bunch of beans and little particles and stuff. Well, now I wrote, so you see here, I wrote that if I add 150 cc's of water into this, basically I have my cold pack. And the reason I carry it this way is that before the water is in a little pocket, and what you have to do is compress it so that it reacts. But the problem is that when you carry that in your pack, a lot of time it happened on me that it activated without any warning. So now I carry it this way. And the advantage too is now in the summer, in the winter, in the summer, sorry, I can carry a cold pack because it's harder to make cold in the summer. But in the winter, I can carry hot stuff instead of this because it's easier to carry a cold pack than a hot pack. So this is what I carry over here. As well as I got 2 of those little babies, and they're to be used with, well, they have different functions and stuff, survival and everything, but as well as they can be used in conjunction with a Foley for some gynae emergencies. So that's why I carry those. And this, I'll do a whole video on it, but basically, as you notice in my pack, I don't carry IV, I don't carry anything to give intravenous and stuff. But with this, which is just a platypus bottle with kind of a special, the tubing for kind of transfer it into a water bladder, there's 4 portion of salt, and those little capsule here are basically those kind of same thing as those hydration salts. So I was trying something, but it doesn't seem to be working very well because, as you can see, it breaks a lot. So I'll probably gonna be replacing those with those pack inside that. So this is still kind of an experiment, but a lot of function to do this, and I'll do a whole video just on that one alone because it's worth it, and I think it's gonna impress a few people. So anyway, so this is my little system, and it's in that pocket right over there. So that was my first aid kit. Hopefully you enjoy, and any questions, just don't hesitate to send me.